Papua New Guinea is facing a surge in coronavirus cases, prompting the World Health Organization to put out a global call for help. The country's Prime Minister says community transmission is rampant, with cases doubling in the past week. Joining us live now is Dr. Rob Mitchell, an emergency physician at the Alfred Health campus. Rob, appreciate your time. I understand you've just returned from Papua New Guinea. Just how bad are things on the ground and how are their health services coping?
Thanks, Ash. It's good to be with you. Papua New Guinea is an incredibly challenging situation at the moment. I'm in regular communication with my emergency physician colleagues on the ground there, and resources are extremely stretched. As you said, they have seen a massive rise in case numbers in the last few weeks. And the numbers that are being reported are probably just the tip of the iceberg. There is a significant problem with undertesting in Papua New Guinea, so there really is a very significant problem, and we hope that the Australian government can step up its assistance to support Papua New Guinea through this very challenging period.
We've seen reports of a different strain of COVID emerging in PNG. Do we know much about that?
We don't know a lot about it. Yes, you're right. The Queensland health authorities have indicated that there is a new strain of COVID-19 that has been detected from Papua New Guinea. They've said that it's not a strain that they're concerned about at the moment. But the best thing that we can do to stop the emergence of these types of mutant strains, if you like, is to suppress the virus. When there is unmitigated community transmission, as is occurring in PNG at the moment, these mutant strains can emerge. So that really underlies the importance of us supporting Papua New Guinea in response to their request for assistance to get control of the virus.
Where is PNG up to in terms of accessing vaccines? I see that China has offered to send PNG vaccines, the government deciding whether or not to take those up. Australia obviously has made some commitments as well. How far off are they from vaccinating the population there?
Well, I was absolutely delighted just in the last 24 hours to see some photos of my colleagues in Papua New Guinea working on the front line of healthcare there, beginning to receive their immunisations. That's a great step forward. The Australian government has released 8,000 vaccines for frontline healthcare workers in Papua New Guinea, and that is a fantastic initial step. I really hope we can build on that initial commitment with some ongoing support to make sure that there is widespread immunisation coverage as soon as possible throughout Papua New Guinea. That is really the key at this stage to getting control of the situation.
How big a risk is it for us here in Australia to have this on our doorstep?
Well, look, it is a risk because there is a flow of individuals between Australia and Papua New Guinea. And as your viewers would be aware, Australia's Torres Strait Islands, particularly Boigu and Saibai, are in really close proximity to PNG's Western Province. Now, I know that the Queensland government has been very proactive in immunising residents of those border communities on the Australian side. However, it's something that we need to keep a very close watching brief on. The best thing that we can do to protect Australia as well as Papua New Guinea at this point in time is to help get control of the virus spread throughout Papua New Guinea. I'm really pleased that the Australian government has provided that initial commitment of vaccinations and some extra resourcing, and I hope we can build on that over the longer term to help build resilience and increase capacity on the Papua New Guinean side to respond to these sorts of disease threats.
We have seen reports coming through that COVID has become a sort of taboo topic in Papua New Guinea, that some people are feeling embarrassed, they don't want to get tests, whether or not they're available or not is another question. Has that been a problem in terms of dealing with some of those cultural barriers?
Yeah, Ash, that's a really important point. There is a lot of stigma associated with COVID-19 infection in PNG. Our colleagues who are working on the front line in healthcare there are feeling it. They tell us that there is a degree of stigma, and that's also impacting on the willingness of individuals to receive vaccination. There is quite a lot of misinformation out there, unfortunately, predominantly spread through social media around vaccination. And so we are trying to encourage them and working with them to send a positive message about the power of vaccination and how that is key part of the strategy to protect Papua New Guinea against the COVID-19 pandemic.
Rob Mitchell, appreciate you joining us and giving us that insight into what's going on with such a close neighbour of ours. Thanks so much for your time.
Anytime, Ash. Thanks.